So, hi everyone and welcome to the last video of drug-drug interactions. So, tapos na tayo dun sa renal physiology natin and we are going to move forward with the drug excretion mechanism. So, let's start. Now, if the drug is bound, they will not be excreted. This is true because, diba, the more the drug was protein bound, the longer it stays in the system. So, meaning hindi siya mag-excrete or hindi siya mag-exert ng effect compared sa drugs free from proteins na mas nauuna sa metabolism, thus mauuna din sa excretion. Also, protein is a macromolecule, so hindi talaga siya may excrete if attached siya doon. Now, if the drug is unbound, it will be actually filtered or excreted. It is free, thus exerting its effect is normal, and then it is readily excreted after metabolism. So the normal GFR of a human person is 110 to 130 ml per minute. But you have to also understand that in the previous video, we mentioned that the normal glomerular filtration rate of the geriatrics is 75 to 125, I guess. But in the normal person na hindi geriatrics, 110 to 130 ml per minute ang normal GFR. Pag lumampas siya dito sa 130 ml or bumaba siya dito sa 110, then you have to consult your physician. Now, for tubular reabsorption, di ba mentioned in the last video na to, after ultrafiltration from the Bowman's capsule, or after the non-selective filtration in the Bowman's capsule, si distal convoluted tubule will reabsorb those lipid-soluble drugs. Kasi nga, one ticket for the drug to be excreted is to be non-lipid soluble or it should be water soluble. Also, if the drug is unionized, it will still be reabsorbed. Remember the Luna mnemonics, lipophilic, unionized, it will be absorbed. So for them to be excreted, they should be water soluble and ionized. So examples of compounds that are being readily reabsorbed are the glucose, electrolytes, vitamins, amino acids, and uric acid. Now, for the tubular secretion, proximal tubule will excrete the drug away from the blood. So, remember, may excrete siya pag water-soluble and ionized na siya. If not, it will be reabsorbed in the distal convoluted tubule pag lipophilic pa siya and it is unionized. So, we are going to move forward with the type of drug interaction considering alteration of urinary pH. Just like sa absorption natin previously, acidic drugs will be absorbed in the acidic environment. Same with the acidic urine. Mariri-absorb si acidic drug pag acidic ang urine. Therefore, ang clearance niya going out of our system will be decreased because it will be reabsorbed back into the system. So you have to also consider your diet when checking your urinary pH because meat eaters tends to have slightly more acidic urine than those vegetarians because vegetarians have slightly alkaline urine. So if you are a meat lover person, then you expect that somehow your urine is acidic or more acidic than those people na laging kumakain lang ng vegetables. So, sodium bicarbonate plus cotrimoxazole. Cotrimoxazole is more soluble in acidic urine. So meaning, if acidic si urine, cotrimoxazole will be excreted kasi nga soluble na siya, di ba? Now, if you are going to administer bicarbonate together with cotrimoxazole, then the urinary pH will be altered. Therefore, there will be an accumulation of cotrimoxazole in the urine. Ngayon, pag nangyari itong accumulation ng cotrimoxazole in the urine, it will not be excreted since nag-accumulate sila, then it will form crystals in the urine. Kaya ang side effect ng cotrimoxazole if your urine is alkaline is technically crystalluria. So, dapat acidic si urine for it to be excreted. Next, Quinidine plus alkaline urine. Same with cotrimoxazole. Quinidine is an anti-arrhythmic drug which is more soluble in acidic urine. Therefore, if soluble siya sa acidic urine, it will be readily excreted in the acidic urine. Now, if urine is alkaline, there will be an accumulation of quinidine. There will be an accumulation of quinidine in the urine. Therefore, it will be reabsorbed in the body, thus rebound arrhythmia will occur since it will be reabsorbed back into the system. And since hindi siya na excrete, parang sa absorption, if you are not going to be excreted, it will be absorbed. So thus the toxicity will increase. Di ba nga ang mga anti-arrhythmics natin, pag naging toxic sila, nagiging cause din sila ng arrhythmia per se. Now, let us move forward with amphetamine plus alkaline urine. Same with previous drugs discussed before. Amphetamine is a soluble drug, amphetamine is soluble in acidic urine. Thus, it favors excretion if acidic nga sa urine. Now, if urinary pH will be altered, then there will be an accumulation of amphetamine in the urine. Thus, it will be reabsorbed back into the system. Therefore, there will be an increase in stimulant effect, or worst, it can cause toxicity, amphetamine toxicity, because it is being reabsorbed in the body and it is not being excreted. Now, we are done with the urinary pH alteration. Let us move forward with the changes in active renal tubular secretion. Okay, so drugs that uses the same active transport system in the renal tubules can compete with one another for excretion. So meaning, nagpapaligsahan sila, sino ba ang unang i-excrete ng kidney? Si drug A ba or si drug B? So one good example of this kind of interaction is the popular probenecid plus penicillin. Probenecid reduces the excretion of penicillin and other drugs. It inhibits renal secretion of many other anionic drugs by organic anion transporter. Ano ba yung organic anion transporter? Sila yung mga transporter na nagre-regulate ng anions natin sa katawan. Anions, meaning negatively charged particle. So meaning, in normal physiology, pag mataas ang anions natin sa katawan, ang OAT ang responsible para i-regulate yon. So ano mangyayari kapag uminom tayo ng probenecid? I-inhibit niya yung pag-regulate or pag-secrete ng anionic drugs, meaning yung mga kasabay niyang anionic drugs ay mag-stay ng matagal sa katawan, or it will stay longer than the normal half-life of the drug itself. It also inhibits some of the ABC transporters in the kidneys, like P-glycoprotein. Ano na kasing P-glycoprotein? P-glycoprotein is an efflux membrane transporter, and it is widely distributed throughout the body, and it is, take note, this is responsible for limiting cellular uptake and distributing synbiotics. Pag sinabi natin synbiotics, these are the foreign materials that are not familiar with the body, or hindi familiar sa body, or wala siyang natural na ganitong compounds like yung drugs natin. So therefore, if this is inhibited by probenecid, so meaning if P-glycoprotein is inhibited by probenecid, then the distribution of penicillin and cellular uptake of penicillin will not be limited. Therefore, it will increase the effect of penicillin. Kaya nga, di ba, they go hand in hand. Alam naman natin na prone to excretion si penicillin, and before, di ba, malakas ang effect ng penicillin nung wala pang history ng resistance ang bacteria nung unang panahon. Pero now that the bacteria are actually resistant to it, gumawa sila ngayon ng way to improve the action of penicillin by co-administering it with probenecid, so that it will increase the effect, or it will allow the penicillin to stay longer in the body. So yun ang kwento ni probenecid and penicillin. Let us move forward with the drugs affected by probenecid. So the following drugs are affected by probenecid. Ini-increase nila or ini-increase ng probenecid yung effect ng mga drugs like cephalosporin, just like penicillins, cephalosporins, dapsone. Dapsone is being used for leprosy. Methotrexate. Ang old name ng methotrexate is amethopterin. So, if ever man lumabas to sa exam nyo, methotrexate and amethopterin is just the same. They are used as immune system suppressant. Parang albuterol salbutamol, ganon. Amethopterin is methotrexate. Also, penicillin and quinolones. These drugs are being affected by probenecid. And this is going to be the last slide for our pharmacokinetic interactions. Now, let us move forward with the pharmacodynamic interactions. So, tapos na tayo sa pharmacokinetic, which merely focuses on the concentration, if it will increase the effect, or it will actually decrease or delay the effect. Now, pharmacodynamic interactions are those where the effects of one drug are changed by the presence of another drug at its site of action. Sometimes drugs directly compete for a particular receptor site, not protein binding site. As I have mentioned earlier, protein binding sites are for distribution interaction and receptor sites are for pharmacodynamic interactions. Often, the reaction is more indirect and it involves interference with physiological mechanisms. And I believe one good example of these pharmacodynamic interactions that was previously discussed is albuterol plus propranolol, which is an example of pharmacodynamic interaction na na-discuss ko na in the previous video. So pumunta tayo ngayon sa one type or the first type of pharmacodynamic interaction, which is additive or synergistic interactions. Synergism, this is being abbreviated as or being written as 1 plus 1 is equals to 3. Most likely lumalabas sa exam to. So always remember that 1 plus 1 is equals to 3. That is synergism. If two drugs, okay, if two drugs that have the same pharmacological effect are given together, the effects can be additive. Huwag kayo malilito. In practice, okay, in practice, additive and synergism are being used synonymously since they are both since they both increase the normal effects of the drug if given concomitantly. So in textbook, additive and synergism are actually separate, or they both have their same meaning, but in the clinical practice or in the practice, additive and synergism are just the same. One good example of synergistic effect alteration or interaction, I mean, is alcohol plus anxiolytics or hypnotics. Alcohol is known to be a CNS depressant, so meaning it will cause drowsiness. Anxiolytics, on the other hand, has the same effect, which is depressing the CNS functions, causing also drowsiness. If taken together, they will cause excessive drowsiness. Kaya nga sinabing 1 plus 1 is equals to 3 kasi pareho silang drowsiness. So pag tinake mo si alcohol alone, ang effect niya is drowsiness. Pag nag-take ka ng anxiolytics or hypnotics, magkakaroon ka rin ng drowsiness, technically. Since synergistic sila, it will produce an excessive drowsiness, so the effect is greater than the effect of a single drug alone. Kaya 1 plus 1 is equals to 3. So pag pinagsabay mo si alcohol and anxiolytics or hypnotics, they will produce a bonggang drowsiness. Now, let us move on with the other type of pharmacodynamic interaction, which is drugs with antagonistic effects, meaning drugs that has an opposing actions in the receptor site. One good example, which was already discussed and being discussed again, propranolol plus asthma drug. Propranolol is beta-1 and beta-2 antagonist since propranolol is non-selective. Asthma drugs like albuterol are beta-2 agonist. Beta-2 meaning sa lungs, beta-1 sa heart kasi nga 1 si heart, isa lang si heart, 2 si lungs, so beta-2 agonist. Asthma drugs are acting in the as beta-2 agonists. They are acting actually in the beta-2 receptors. So if given together, they are actually opposing. Thus, the result is cancellation of effect. And as discussed also earlier, that if you have an albuterol toxicity, then you can give propranolol as an antidote. Now, let us move forward with pilocarpine plus anticholinergics. So pilocarpine or pilocarpine, I don't know how do you pronounce it in your own way, but pilocarpine is a cholinergic agonist, meaning binimimic niya yung actions ng acetylcholine. And as we know that the actions of acetylcholine are for parasympathetic nervous system, which contracts smooth muscles, dilate blood vessels, I believe. Yes, it will dilate blood vessels, increase bodily secretion, and slows heart rate. That's parasympathetic nervous system. Now, if you have taken it with atropine and any other anticholinergic drugs, as we all know, anticholinergics are acting naman for sympathetic nervous system. Or, ano na kasi yung sympathetic nervous system? Fight or flight response. So, meaning, pag pinabilis, so meaning yung fight or flight response kasi, di ba, siya yung nagpapabilis ng heart rate, it decreases body secretions. So the resulting effect, if pilocarpine is being given with anticholinergics, they are antagonistic in their receptor site. So just a simple recall lang, nung anatomy or physiology natin, or even pharmacology, i-recall lang natin, parasimpa is basa normally. So you have to remember that parasimpa basa kasi nga it increases body secretion, yung tears mo lalabas, yung sweating. Now, on the other hand, sympathetic, ito naman yung mga tuyo. Kasi nga, di ba, for example, nasunugan ka, so hindi ka naman technically pagpapawisan or hinabol ka ng aso habang naiihi ka. Di ba uurong yung ihi mo or nagje-jebs ka? Hindi ka naman magje-jebs habang hinahabol ka ng aso eh. So that's your sympathetic response. So again, para sympathetic, basa, sympathetic, tuyo. Yun lang ang kailangan yung tandaan sa dalawang yan because maybe this one will be given in your board exam and you have to really remember parasympathetic and sympathetic nervous system. Now, let us move on with anticoagulants plus vitamin K. Kung nung last discussion, si antibiotic ang kapartner ni vitamin K, ngayon naman si anticoagulant. Paano sila naging opposing? Pag kumain tayo ng green leafy vegetables like talbos ng kamote, kangkong, malunggay, they are actually rich in vitamin K. They produce vitamin K in the presence of phytomenadione. So phytomenadione is the vitamin K produced by plants. So if mataas ang vitamin K mo, tapos may anticoagulant ka, syempre, procoagulant, anticoagulant, they are actually opposing with each other. This interaction may be good or bad depending on the use itself. Kung may anticoagulant toxicity ka, better administer vitamin K ampule or pwedeng kumain na lang yung patient ng green leafy vegetables. It will help it will help lessening the toxicity of anticoagulants together with the vitamin K ampule that is being administered, syempre. Pero kung ang goal mo is to prevent coagulation per se, tapos nag-vitamin K ka, then it would not be better to use it concomitantly. So advise the patient to as much as possible avoid eating green leafy vegetables when taking anticoagulants, especially if your goal is to prevent coagulation, lalong-lalo na dun sa may mga what do you call this? Yung may mga na-stroke, mga ganon, yung may mga blood clots sa ugat. So other drugs with anti or antagonistic effects like paracetamol plus N-acetylcysteine, loperamide plus dulcolax, morphine plus naloxone, warfarin plus protamine, Pradaxa plus Proxbind. If you will notice, okay, N-acetylcysteine, dulcolax, naloxone, protamine, and Proxbind are actually their antidotes. Therefore, we can say that the drug that will antagonize the effect of the other drug can be considered as actually an antidote. So meaning, kapag nagkaroon ka ng toxicity ng mga to, then the first thing you need to remember is to give this one. Technically, para ma-counteract yung toxic effects ng gamot na to, ibibigay mo to. Okay? So, that is going to be the last slide for pharmacodynamic interactions. So, tapos na tayo with drug-drug interactions. And in this section, drug-herb interaction and drug-food interactions, a separate table will be provided by Sir JP. So, si Sir JP na ang magbibigay ng handout sa inyo. And I would like you to remember everything that we discussed because this is beneficial not only for your board exam, but also in the clinical practice itself because this drug-drug interaction is very crucial, lalong-lalo na sa mga patient kasi we do not assume patients na alam na nila ang mga ito. So, if you are technically being knowledgeable about the drug interactions in the practice, then you will gain the trust of your customers or your patients in the community setting. Then, the patient will trust you. Then, the patient will patronize actually the community pharmacy where you are working because of you. So it will add up the sales of the community pharmacy. Or ang important kasi is ma-build natin yung rapport with the patient natin. So that being said, you need to just further go to the basic. And I advise you to use this in everyday scenario. Every time you are dispensing, you have to carefully dispense it with heart. Okay? So, thank you so much for attending all of my videos. And thank you so much for your attention. And let us see each other again in the next videos for adverse drug reactions and introduction to pharmacovigilance.